Howdy. I'm going to show you today how to customize your examination. This is the first step in speeding up how you improve your workflow and get things documented effectively and quickly. If you look over here, eClinicalWorks comes with a bunch of preloaded examinations. Um, Look over here, there's examination and physical examination. I always use physical examination. I don't know why they have two things, but it is what it is. When you go to customize, first going to use one of the other providers who created their own thing, but didn't really customize it. The way you create your own physical examination is to go down here to custom and click new category. And I'll put here line test. Um, and now you see it appears, and this is completely undone. So the next level is adding new items, and that's how you get to add these items here one by one. You have to add them. You can change the names by updating the items. The trick is you cannot change the order of them, so make sure you put them in the order that you want them. So going back to his examination, he has his items that he likes to put. But when you click on the notes, this part here is blank. If you look to my customization, I use this dash right here. This is my examination. I did it a long time ago. This takes a lot of work, but once you do it, you'll see how nice and how quick it can be. For each category, these are the categories that I typically document. For each thing, I put the normals and abnormals that I usually use for me. Alert, no distress, normal habitus. Abnormals include oriented ×1, lethargic, thin, cachectic. So as you're documenting things, you can quickly pick something abnormal, and you can see when something's abnormal, I have it as red. The way you add all of these things in is by using this custom, and you basically one by one add the findings that you like. I create the abnormal findings with the color of red because they'll stand out. And when you go for follow-up, you'll know this is the abnormal thing for that person. So when you copy and paste the previous exam, you'll know what to kind of look for to document it as better or worse or whatever. But we don't want to have to sit and pay attention to what's the different thing, what's the new thing. So having the abnormals in red allows us to do that quickly. If you'll notice also, I have my default as X's, and this goes for all of the categories. Things that are normal are default. So I can clear this. When I click default per category, this is my usual normal exam for a normal person with no problems. This is what I like to put, and this is what I've created as my default examination that covers a bunch of systems and a bunch of findings that are all normal. Now, when I see this person on follow-up and they've got a cold, I'll click on the green part. When you click on the black, it looks a little bit differently, and it's a little bit, for me, a little bit slower, a little bit more awkward, but you can use this and it looks differently. The typically is to click on the green part, and what I'll do is I'll just clear the normals and the abnormals: sinus tenderness, frontal, mucosa boggy and pale. Chest, it's not normal, it's faint expiratory wheeze and scattered rhonchi. In general, they don't look well. They're alert, appears ill, tearful. And so when I go on follow-up and I'm seeing these red things, especially for like musculoskeletal issues, chronic pain that, you know, they always have low back pain, paraspinal spasm, straight leg negative or positive, whatever. Typically on follow-up, I'll keep this abnormal because this is their abnormal, and I'll just put unchanged, improved, worsened, except for limited range. I have different things that I change very quickly because for me, I don't want to spend a lot of time examining or documenting the exam. It needs to happen very quickly and be able to grab the abnormals and move on. We need to make sure we, write the right prescription and do the right orders. But for me, examination should be very minimal and very brief, but it's very important. So this is how I have my stuff customized. Now, if you want to clear everything out, everything goes away, and again, you can walk through each one of these things one by one. And what we'll do is we'll provide a printout of all of the abnormals, and basically you have to add them one by one in this custom categories. All these things, each abnormal thing, it takes a lot of effort up front, but in the long run, you're able to document very well, very quickly. So take the time and effort for each item, put all these normals and abnormals that you like to typically put. Here's my nose findings. Or I'll just scroll through here. Here's my general exam findings. I can click next. Here's my eyes findings, all the abnormals. Next. Here's all the neck findings, which are normal and abnormal. Ears, here's all my ear findings, normal and abnormal. And I can quickly just put bilateral increased fluid pressure, tympanic membrane red on the right side, bilateral, whatever. I can very quickly grab the abnormals. And then on follow-up, I copy and paste, and then I either delete it because it's resolved, or I put that it's better or worse. Or even just documenting unchanged says that you're doing something. You paid attention, you're not just, you should never completely copy and paste from the previous. Something should be different somehow, even if you're putting unchanged. Here's my nose findings, normal and abnormal. You can have oxygen in place. Throat findings, normal, abnormal. Cardiac findings, normal, abnormal. You can put extra stuff, thrill, whatever. There's plenty of other abnormals that you can add, or plenty of things that you can leave off. Chest findings, left greater than right, right greater than left, bilateral, no wheeze, no crackles, increased expiratory effort, or yes, they do have it. Intermittent wheezes, all kinds of abnormals you can document. Abdomen, there's a lot of different abdomen findings you can put, rebound, no rebound, guarding, no guarding, diffuse, sharp, different ways of explaining abnormals, mild, moderate, severe tenderness, positive Murphy's, no rebound. So again, this is all customized. Musculoskeletal, lots of different things you can put, lumbar, cervical, thoracic, pain, paraspinal, spasm, weakness, upper extremity, lower extremity, neurologic findings, all kinds of different neurologic findings. And again, you enter them one by one. You customize your list. You put the abnormals in red. The normals you want as default. Psychiatric, mood is good, bad, anxious, depressed, agitated. Affect is normal, flat, labile, tangential speech, cooperative, uncooperative. Skin findings, different abnormal things. Urologic, normal testes, hernia noted. I have a noted whatever to describe other things, and that's helpful for dermatology. There's always different ways of describing things that you can't put as a pop-up. That's it. And if you'll notice, when I put my default per category, I don't have urologic typically put because I'm not doing a rectal exam or a hernia exam on everything. This is my usual for a usual thing. I have a different template set up for telemedicine. Again, you have to customize this. And these are findings that you're not listening to the heart and you're observing no increased work of breathing, or maybe they do have it. These are all observational physical exam findings that are appropriate for telemedicine. But that's a whole nother thing. So I think that's enough to get you started for now. And good luck with your customizing. It takes probably a couple of hours to put all the categories and everything, but it's a one-time thing and it saves you so much time. Once you get it all done, it will speed you along and you can pay attention to other things with your documentation. Thank you.